Hello, and happy fall to our families. I'm Gwen Natazak, the school nurse at Boonesboro Elementary School.
I'm Amanda Taylor, the school nurse at Bedford Primary School.
And I'm Kim Walton, the nurse at Stanton River High School. We are thrilled to be able to say that we have enjoyed our first quarter of face-to-face instruction in Bedford County Public Schools. We want to thank you all for the opportunity to serve your children in school and how much we appreciate your help in keeping our students safe. Our schools opened with a commitment to ensure students were able to access on-campus experiences, and what a victory these 9 weeks have been. We want to offer a few reminders of our continued efforts at prevention of COVID-19 exposures. As nurses, we have been working diligently with families to make decisions regarding illness-related symptoms, quarantine, and return to school. Advisement and contact tracing about a need for quarantine is difficult for everyone involved, but these outcomes are necessary to reduce the likelihood of virus spread in the school buildings and within the community. We appreciate the patience of the families who have worked with us through this process, and we will continue to face these situations as the year continues. We recognize the short-term hardship that quarantines may create, but this may prevent more disruptive school closures in the future. We also ask that if you are asked to quarantine, please limit school and community activities to help keep others safe.
Please also remember that your morning home health screening should not be taken lightly. As parents, you know your child's normal, and when your child is feeling unwell, we must ask that you make decisions based on caution and have your child stay home when needed to monitor symptom changes. Children who've been found positive for COVID-19 can have fluctuating or unusual symptoms. A consultation with your school nurse may help you make decisions. So please feel free to call us. A short illness at home might mean a temporary inconvenience, but it also may prevent the risk of exposure that could quarantine entire classroom groups.
Families, know that your children can only stay safe when they play safe. If you are participating in recreational activities beyond school, please emphasize that safe and healthy sports and play protocols are important, as these activities can impact many school groupings. This may mean altered play or practice routines. These alterations are better than having to stop all activity because of illness or quarantine. Quarantine means keeping people who are exposed to a sick person away from others. This means staying at home and not participating in activities outside of the home. Talk with activity planners, coaches, and other families to ensure that any gathering of children and adolescents includes expectations for face coverings when not physically active, physical distancing during non-play periods, and safe cleaning and handling of shared materials. Respect other players and students by staying safe on the fields as you would want to be safe in the classrooms.
As we are entering the holiday season, be mindful that we are entering a time of cold and flu symptoms. We may also see a rise in coronavirus symptoms as well. First and foremost, continued in-person instruction is our focus, but safe practices are the key. Now, even more than when school started, we must be attentive to our children and staff maintaining adequate face coverings and understanding that consistent social distance is the standard for healthy interactions. We will continue to be cautious with controlled groupings to minimize risks, but this is less effective when participants have broad ranges of public gatherings and activities outside of school. Prevention efforts can be easily implemented when we focus on what we gain by staying in school rather than focusing on what we may have to restrict. Even though we've been doing this for a while, now is not the time to become relaxed in our prevention efforts.
The health and safety of our students is the #1 priority of the school nursing team, but we need your partnership and continued commitment as well. Thank you for your trust in our care, and we look forward to seeing your child's smiling face in school for the rest of a healthy school year.